Hey everybody, welcome to our weekly coffee chat. It's Lorraine from pregnancyexercise.co.nz, pre and postnatal online exercise and wellness specialist. Okay, so in today's video, I'm going to be giving you lots of tips for wrist pain during pregnancy and postpartum. Now, over the past 4 years especially, I have seen massive increases in wrist pain, both pre and post. In fact, especially more so post. You know, out of the 10 women, you know, I see new groups of postpartum mums come through all the time, and around about 3 out of the 10 mums, so a quite high percentage, can be suffering from the wrist pain postpartum. Now, predominantly it's an overuse injury, but it's exaggerated, of course, during our pregnancy by our hormones, okay? And you can maybe diagnose with what we call it as decubitus tendinopathy syndrome, all right? So basically, let's go for wrist pain, aching. Now, what can we do to try and not only prevent this wrist pain, but ultimately manage it better when we have it? Because sometimes the only things which can help is if you go to the physio or a doctor is generally steroid injections or wrist guards. But we can prevent it getting to that stage, and we can really help to prevent that increased pain and discomfort by managing how we are lifting babies, carrying, breastfeeding, etc., and just knowing to also what to be aware of. Now, the main thing is the aching, which is felt down here, and this is really common. So what we need to avoid is this, okay? This predominantly causes that aching all the time. Now, as soon as I start to let you know of all the different ways you can help prevent this, you will realize how often you may be holding babies, or guess what? Your mobile phones. Now, there is a theory that because mobile phones have got wider over the years, it's also increasing this postpartum wrist pain. So when you're breastfeeding, try not to have hold of your mobile whilst you're breastfeeding. If you can use a touchscreen or a swipe, or even onto your computer, or eat a lunch with one hand, that can certainly help. Whilst we're on about breastfeeding, okay, when we're feeding our babies, another good way is to try, because we can again be like this, holding them up. So it's this what we want to avoid. So if you can, choose a softer grip. So over the top is better than hunched up over. Okay, so that can be better. When they start to get heavier, lying back, again, we need to think about not just ways to prevent it, but to manage this pain. So think about that when you're breastfeeding. Another one, what I also say to mums is when you're picking babies up off the floor, and especially babies once they're more than 5 kgs, is trying not to pick them up like this, okay, because we can hold them up like this, and again, this can add a lot of pressure on mum's wrists. So what I always say to mums is, can you try and scoop them up so we've got that softer wrist when we're holding them? Again, great to just be aware of it, keeping the wrist that's more painful maybe underneath, and keeping it soft. All right, so there are 2 really good tips what you can put into your day with the breastfeeding, lifting, and holding babies, avoiding this. Now, in terms of exercise, what exercises can you do again to help with this? Now, through the Birth to Fit Mum program, Taster series, I always now, because it's so common, offer the alternatives for when we're on the wrist. Now, the best thing I can say in pregnancy and post, if you're doing any support exercises, don't do them against the wall or on your kitchen bench. Use your couch, and you can come down onto your forearms to do any of your glute exercises, Supermans, etc. Core exercises can be done. If there's no different options, you can come onto your fist, and again, it's nice to be on this level, so you're not putting too much pressure down onto the wrists, to start to do your core exercises from there. Dumbbells tend to be better with wrist pain because, again, you can slowly come up and keep this, as opposed to sometimes when you're lifting with the bands, it can cause the aching through here, which again is going to restrict your blood flow. So hopefully a couple of tips there for you on wrist pain, pre and post natal. Also great for any RSA, eye injuries when you're on the computer, etc. So we need to watch that position also. Okay, hopefully you enjoyed today's coffee chat. I will talk to you all soon. We have had some issues, unfortunately, on the website the past 24 hours. The membership system is still down at the moment. We've had to move our server because the website did get attacked, unfortunately. Everything's going to be fine. Everything's still safe and secure. We're just moving things around. So hopefully the website's back up and running because we have the No More Mummy Tummy Challenge that is starting on Monday. Thanks, Diana. Take care, everybody. Talk to you all soon. Please recommend our pre and postnatal programs to your friends and family. Bye, everybody.